Good afternoon, everybody. My name is Bryan James, and I'm a physical therapist and clinic director at KORT Bryan Station in Lexington, and today we're going to be talking about falls. So the reason that we picked this topic is for community awareness and to let you all know that you can be assessed and treated for this problem. 1 out of 10 people after falls will experience a serious injury, and this could be a fracture, this could be a brain injury. This isn't limited to clumsy people like me. Over the age of 65, 1 out of 3 people are going to have a fall over the next year. So this is a pretty prevalent problem. The good news is that 30 to 40% of these falls are preventable. And today we're going to go over a screening process with you and let you know how KORT can help. So starting off with the first screening test, it's the timed up and go. And the way that this is set up, the patient's going to be sitting in a chair and there's going to be a cone or a piece of tape on the ground that's about 10 feet away. We're going to ask the patient to have a seat in the chair and then stand up from the chair, walk to the end of the tape at their normal pace, come back and sit down. We're going to time how long this takes for you to do. We're going to start the timer as soon as we say go, and we're going to stop it as soon as your bottom hits the chair. Now, statistically, we have a lot of people that have done a ton of studies on these tests. And what we know is that if your score is over 30 seconds to complete the test, you're having trouble with activities of daily living. If it's over 14 seconds, you're at a pretty high risk for falls, so that should be on your radar. If you're between 10 and 14 seconds, you're at a much lower risk of falls, but the risk is still there. And then under 10, you're good to go. We're happy with that score. The second test that we're going to do is a single leg stance test, which is pretty self-explanatory. We're going to put you in a controlled environment, have you stand on one leg, and see how long you can hold it for. If you can last longer than 5 seconds, you're pretty good. Under 5 seconds, it's cause for concern. You may be thinking like, Bryan, why do I need to stand on one leg? Like that doesn't even compute for me. Well, we use this a lot with daily living activities. Things like putting on shoes and socks, putting on pants, going up onto a curb, going upstairs, getting into the bathtub. These are all single leg stance activities that we don't often process that way. The last test that we're going to do to screen you is the 5 times sit to stand test. For this test, we're going to have you sitting in a standard chair with armrests. The way the test is written is we would have you cross arms over your chest. You'd be sitting in the chair, and we'd have you stand up and down 5 times as quickly as you can. And we'd time how long it takes you to complete the test. If you last longer than 15 seconds, that would put you at a higher risk for falls. Under 15 seconds, you're good to go. And those are the things that we would run you through. Now, if you're listening to this and you're thinking, oh man, I don't know, just listening to that sounds tough. I think I would have a hard time doing those. Well, then come on down to the clinic and let us check you out. Each time you come to the clinic, you're going to be paired with a therapist, and they're going to give you an hour of their time. They're going to go over your medical history. They're going to be addressing your primary concerns. They're going to move from that to an objective exam, where we're looking at some of these screening criteria. We're going to be looking at your mobility. We're going to be looking at your strength, your range of motion, sensation, all those things, just to make sure we're having a good understanding of what it is that might be contributing to your falls. Let me think. So, like moving beyond that, you might be thinking like, okay, well, am I appropriate for this fall assessment? And the question is, yes, it's appropriate for anyone. Any age group, if you've had a history of falls, if you're concerned about falling, then you're appropriate for an assessment. So age is not an exclusion or inclusion criteria. If you use an assisted device, a cane or a walker, that's perfectly fine. We welcome those patients as well because we want to be able to assess the reason that you're using those, and if you're safe with it. We can adjust the height, making sure that it's appropriate fit for you. You may be asking yourself, I'm dizzy, am I still appropriate for this test? Well, yeah, we want to figure out, with this dizziness, are you still functionally able to get around? Are you safe? If you have abnormal sensation, this could be related to low back issues, this could be related to diabetes. Like this is another big fall risk criteria, risk factor that we're looking at to make sure that we understand the whole picture and if you're appropriate for therapy. To piggyback on that, some people are thinking, okay, well, my mobility is just not that great. I'm concerned about getting out of the house. Like, what can I do from this standpoint? Well, we have a team that will come and see you in the home. They'll assess your home environment to see, what are some risk factors for falling at the house? Do you have throw rugs that are a nuisance? Do you have pets that get tangled in your feet? These are simple things that may seem obvious when I'm talking about it, but a lot of these result in falls at the home. In fact, most of the falls happen at a home environment, usually in the bedroom or the bathroom, where we spend a lot of our time getting ready and groggy, getting up, things like that. So the reason I'm looking off to the side, I have a colleague of mine here today that's going to ask me questions because I'm probably going to forget some things that I need to say. So we're just going to default to her and see if there's anything else that I need to cover for you guys today.
Thanks, Bryan. Do I need a doctor's referral to do this fall risk assessment?
So we are in network with most insurances that don't require a doctor's referral. So if you have a question or concern, just go ahead and call one of our clinics, or you can go to KORT.com to schedule an appointment, but you don't need a doctor's referral to reach out to us.
What locations offer this program?
So every one of our KORT locations offers this program. We all have therapists that are specialized in this area that are happy to look at these deficit areas to check you out. So whichever location is most convenient for you, whichever one's closest to your home, go ahead and reach out to that clinic and get the ball started. Don't delay.
Where can I schedule an appointment?
Scheduling an appointment, just go to our website at www.kort.com, and then the rest is seamless. We'll take care of you from there.